My name is Dr. Jeff Korab. Here at Preferred Foot and Ankle Specialists, we specialize in all aspects of foot and ankle care, from diabetic foot care to ingrown toenails to biomechanical issues. For me, it started when I was young. My grandfather was an OBGYN, my mom was a nurse, so I had it from a very early age that taking care of people, and particularly their health, is a big deal, and helping people get better is very satisfying. I was a basketball player, and I was having trouble with my Achilles tendon. I was threatening my season, so my mom took me to see her podiatrist at that time, and he had a very clear treatment plan for me. It worked, it got me better quickly, and I was able to recover from my Achilles issue without having to miss any time. It just left a real positive impression on me of the field of podiatry, and then from there it was I went with it. So when I got into college and I knew I wanted to do medicine in some aspect, I looked into different fields and different doctors and specialties that I'd seen, and podiatry just kept coming back as something that just resonated with me. When I have somebody come into my office and they're struggling to walk comfortably because of a painful condition, whether it's an ingrown toenail or a painful heel, it's one of the most satisfying things to be able to treat them on the spot and alleviate their pain and have them walk out better than they walked in. Knowing that I can make that sort of influence on somebody's life, almost immediately is one of the most satisfying things you can imagine. Because that's the whole reason why I got into this in the first place, was to help people. When you can instantaneously see that you help somebody, that's the essence of what we do. I'm thinking of a particular lady who came in. She had seen many different specialists over the years, had had a few different surgeries, and they all seemed to fail. She continued to have pain, and I was able to really get her history, figure out exactly what was going on, and then we were able to get the proper imaging to come up with an accurate diagnosis. And unfortunately, the diagnosis that she had had before wasn't right. She had been misdiagnosed, and that's why her treatments previously had failed. So we were able to come up with the accurate diagnosis and an appropriate treatment plan. She was able to, for the first time in many years, walk without pain. The approach that we have to patient care is excellent here. We're looking at the entire patient, not focusing only on the foot. We're looking at how their foot affects the rest of their body. Their knees, their hips, their lower back. If they're diabetic, does their diabetes affect their feet? I feel like when a doctor genuinely cares about their patient, that all of their medical decision making is with that in mind. It's not my goal to drag on treatment. It's my goal to get you better as fast as we possibly can in a safe manner. If we're able to do that, we've achieved our goal for sure.